Welcome, everybody, to Ask Muneeza, special edition with Dr. Phan, your favorite medical medium doctor. Um, Welcome to the show, Dr. Phan.
Hello, how you guys doing? Happy Friday.
Happy Friday. I'm just going to do a quick show on Instagram that we're live. Hey, guys, we are live on YouTube with Dr. Phan. Today, we're discussing a very interesting case, so come and join us. All right, Dr. Phan. So, what are we talking about
Well, I'd
today?
like to present a quick case of a patient I just saw recently. Here, the funny thing is this: we were talking last night about 5-10 minutes about what to present, and it was like, well, there's so many things we can present. Why don't we do like a case study? I'm like, yeah, but it's just a little hard to kind
Yeah,
of get it done
yeah.
the night before. So I threw something together, and the patient actually came in this morning, and she knows you, and her results are pretty remarkable. And so I figured that's a sign that something is pushing us toward that way to have her, because she traveled to see me here. So I threw together something really quick, and forgive the roughness of it. I'll have to be switching back and forth in a little bit. I can share my screen.
Yeah, it didn't look rough at all, by the way.
Yeah.
It looks pretty well done. Um, yeah, so for those of you joining us, you know the drill. You know, if you want to say hello in the chat box to us, Jill F says hello, Jay Markwell says hello. And if you have questions, as always, put them into the chat box, whether on YouTube or you are on Facebook or you're watching from LinkedIn. We're streaming to 3 platforms right now. And I wanted to really start doing some case studies with you all, because so many of you ask questions about learning and going deeper. And I feel like that's some of the best use of Dr. Phan's time, because he's a medical doctor and he can explain so much from the medical side. So without further ado, let's share your case study and talk
Okay,
people
let me
through
go
it.
back to the beginning of it, because I went through it. So this is, if I can here, I can get to the, oh no, case report. Here we go. This is today about thyroid, actually. And the patient came and saw me a few months ago, and we talked, and we've changed her medications a little bit. So we're going to go, what do what comes to mind when you think about thyroid management? And in our world, medical medium world, we're trying to marry to both the conventional and the protocols that we have. And so her goal, the patient, was to really get off thyroid medication. So we switched her from Synthroid to Tirosint. Tirosint is a cleaner version of levothyroxine that doesn't have as many binders and fillers that Synthroid does. Synthroid is gluten free, but there's always titanium dioxide and other things in there. So I've found that Tirosint, even at the same dose of Synthroid, is a little stronger, more potent. And indeed, I think we were 88 micrograms of Synthroid. And after being on starting the medical protocol, I said, we need to go to 75 of Tirosint. So from 88 of Synthroid to 75 of micrograms. And so she followed up today to talk about how she was doing and to review lab work that she had done earlier. And so initially she said, I was taking the medicine, and there was about a month where I was having these headaches coming off of Synthroid to Tirosint, but those resolved, and she's continued her regimen. Right, her current symptoms were she's still having insomnia. She's waking up, around 2 a.m. feeling hot, but 2 out of 7 nights she's sleeping well, and that's actually a victory for her. It's improved, right? And her husband was with her too, and he's like, yeah, that's good for her. And we're thinking maybe the
Mhm.
hours of the detox. She does take a mango at night. She does use supplements. Um, she's still fatigued, though she has a bit more oomph, and there's still that kind of that daytime slump that she's having around probably in the afternoon. Am I going too
Yeah.
fast, or you got me?
No, I think it's good. You guys can follow, right? Everybody's following what we're sharing here.
Yeah, let us know. Let us, because I
Let us
talk kind of
know.
fast, especially on camera. so so this is what she's kind of dealing with. And recently, she introduced iodine in end of March, and she's tolerating it pretty well. She's doing a drop a day. She still has some left shoulder pain. I thought it was shingles, non-rashing shingles related, and she's using lysine and cat's claw with some improvement, she says. Okay, keep in mind that when you're talking to me, a lot of patients who are talking to me, I was like, they're giving me the benefit, right? They'll say, yeah, it's working, I think. And so you always have to take that in mind when you're a practitioner, because they kind of want to please you, and especially our medical community, they're very nice. They want to like believe that it's working, and so you always have to say, what if, play devil's advocate and say, well, maybe you're painting a rosy picture. But I think in her case, we were seeing some good feedback. So she has history of using these supplements. She's on curcumin, barley grass, the heavy metal detox. We adjusted some of her timing of her lemon water, celery juice, and heavy metal detox because it was too much liquid. So she was pushing it back, but she was getting some food in the morning, so she wasn't going for 2 or 3 hours without replenishing her glucose levels, right? As I said before, she went from 88 of micrograms of Synthroid to 75 of Tirosint. And so she has hypothyroidism, Hashimoto's, insomnia, fatigue. She's had bunion. She's had tinea, which is, fungus, oral periodontal disease, osteoporosis, urinary frequency, Lyme disease in the past that she was diagnosed with, and, allergies and stuff. So she's had, some surgeries like C-sections and basically for that hospitalization for that. There is a family history of liver cancer, hemochromatosis, and diabetes in her father. And her mother has Hashimoto's. Remember, it runs in the family. A lot of times you pass your viruses to your, progeny. She had she had Hashimoto's. She has dementia as well. So she's dealing with that. It's kind of stressful, She used to drink caffeine. She stopped. She reported she's doing hot water, boiling water. That the whole ritual. She needs that ritual of drinking something warm. So water is better than coffee. She was using black tea, I believe. And she has some of these hobbies. She's married with 3 kids, and she works as a homemaker. So we wanted to assess her thyroid, okay, and talk about her issues with sleep and stuff. So I'm going to share this screen if I can. I'm going to share a different screen. Let me go back here. And this is what I found very helpful, I should say. Let's see if I can see where my... I can see. I need to figure out how to get this picture on here. How do I get this picture on here? How do I share a picture? Window.
You would just have to share.
Doesn't give me the option of that.
Doesn't give you the option. Can you put it on the side?
I will try. Let me see if I can do this one here. Let me share the entire screen, maybe. Are you seeing that? Are you seeing this?
I'm getting an option. Hang on one second.
Okay, so this is her lab work. I've tried to not include her name, obviously. Do you see this? Let me see if I can zero in on it. This is the TSH, thyroid stimulating hormone. The most recent, this is March 7th that she took the blood work. And then this was compared to June 25th of 2024. So more than half a year ago, right? So here she was on the right side in June of 2024. She was on Synthroid of 88. And you look at her parameters here. Her TSH was 2.93. That's thyroid stimulating hormone, a signal from your brain to your thyroid to produce more or less. The higher the TSH, the more it's demanding thyroid hormone. Does that make sense? Yeah. And so we also have a free T3 level here. I'm sorry, T4 level here. And it's within range. You don't see a red flag. Okay, so we have what she was on when she was taking Synthroid 88 on the right side, okay? Now, March 7, 2025, on Tirosint of 75 micrograms, so a lower dose of T4 in general, you see now her T4 has jumped up past normal. It's high. And so it suppressed her TSH, the stimulating hormone. It's saying, I got enough. I don't need to call your thyroid for more thyroid hormone. She's actually getting too much thyroid hormone.
Right.
Does that make sense? So now that means at even a reduced dose of Tirosint, she's getting too much. And she had recently done a cleanse. Okay, she did a simplified, not the advanced, but just simplified cleanse. So, whoa, hey, we need to back you off of thyroid medicine. Does that make sense?
Right. Yeah, totally makes sense. Is everybody listening, following what's happening? If you have questions about what Dr. Phan is presenting, put them into the chat box and we will share the screen with you.
Okay, so you see this is the thyroid number. So that's, to me, good because now we've reduced the dose of thyroid. Our goal, again, is to get off of or the lowest dose we can. And maybe because of the cleanse, maybe because it's a cleaner product, we don't need as much. Okay? So that makes sense. Now, I'm going to move down to the lipid panel, the cholesterol panel. And you look, this is, again, right after a cleanse. In June 2024, her total cholesterol was 205, and it's kind of light, I guess, but it's 205, and they like it ideally below 200 per the reference range. Okay, so that's high. You also
Right.
notice her HDL, or good cholesterol, is 61, is normal. Her triglycerides are 91, that's normal. VLDL, we don't look at it as much, but okay. But the LDL, the bad cholesterol, the lousy cholesterol, they call it LDL, 128 is high, and their parameters for normal are less than 100. So she's high here on her thyroid medication, okay, or the Synthroid 88, okay. Jump to March, look on the left side here. We now see a total cholesterol of 156. Now, what is the delta there? We're looking at almost 50 points, right? 51, or sorry, 49 points. 49
Yeah.
points drop of cholesterol. Not putting on her statin drug or anything. You look at the yes, her good cholesterol dropped a little bit. That's expected. Her bad cholesterol, LDL, 128 to 91. Okay, so
So we have
yeah,
a question from the
yeah,
audience before you go on. Someone is saying, can cleansing increase cholesterol?
it did not. It did not. It did not.
It does
What are
not.
you looking at? On the right side, you're looking in June of 24. After the cleanse, March of 2025, the total cholesterol went down from 205 to 156. Do you see? The most recent one is 156 in March.
I would say that there is a case when, if you have a fatty liver, which most people have for many, many years and decades, when you start eating fat-free and doing many cleanses over a period of time, if you do blood work in between,
Yes.
you might notice
Yes,
that the
that's
blood
something I
work
want to
is
bring up too. So
registering some.
this is a good, results may vary. Comment here is that when you have a lot of fat in your liver and you're pushing fat out of your liver, well, guess what? It comes into the bloodstream. You'll see a high cholesterol. You're like, well, I'm trying to do the right thing. How come it's higher, right? So that's something to consider as well. You may not have the results, but we see that her cholesterol has really dropped, right? Could you argue that perhaps, and again, we're playing devil's advocate, could you argue that because she's hyperthyroid, she's just getting rid of her cholesterol? Maybe she's getting too much thyroid medicine, maybe, but I don't think you can discount the effects of the cleanse. So her
Yeah,
bad cholesterol
that's
LDL went from 128 in June to 91 in March, right?
and
Yeah.
there's another question about, does this person still have their
I
thyroid?
think yes, she does, as far as I understand. She has not had a
She does.
thyroidectomy for what I recall.
Right.
Okay. So that's just two
Okay.
parameters. I didn't get everything else, but these are some parameters that are really good here. Let me see here. Nothing else. Hopefully, I'm not giving any. Yeah. Okay. So that's that. I'm going to stop sharing. So just in case I don't give any information, but yeah. So let me see. Okay, so that's that. And again, her husband also had good results too on his blood work. I mean, as far as so the cholesterol went down for him as well. So there's two people on this. One, why would both of them be on the cleanse? Because they're husband and wife bring their cholesterol down both. To me, that's a cleanse. It's not just because his liver is different than her liver, obviously, but the cleanse definitely brought both of them down. Would they go back up again? Potentially, but I think with saying that just the simplified did that. Now, what would happen if she did the original or the advanced? And she did feel more energetic during that time. So the hope is that doing more cleanses will get you even closer, or lower dosing of your thyroid medicine, right? Yeah.
100%. 100%. Such an important point to figure out. Somebody asked a question about being pregnant and dealing with mold. What I would say is, honey, I have a webinar for pregnancy, birth, and all of that coming up. So it's on April 6th. It's like 2 days from now. I'm posting the link here so you can check it out. The link is in the chat box. If you'd like to know more, let me know. But I'll sign up for that and be there because I will be taking those types of questions there as well. All right,
Back
Dr.
to
Phan, back to
the
you.
presentation that I have here real quick here. So basically, what we did was addressing heavy metal exposure in our family history, and then of course continuing the virus. I wanted to really recommend that we reduce the dose of the tyrosine from 75 to 62.5. The tyrosine allows you to go to 62.5. Synthroid doesn't. You got to either 50 or 75, and 50 was a little too fast, I think. So she was a little reluctant. So we kind of settled on 62.5. Okay. And then I said, look, if the fastest you can check this again is probably 4 to 6 weeks. That's when the TSH will change. We want to make sure that she's not overstimulating herself, right? And even that, if we reduce the dose, her sleep might get a little better because the adrenal is being pushed a little bit, probably by the elevated T4, perhaps. Does that make sense? Yeah. And
Yeah,
I said, look, think
totally.
about using GABA because she was waking up at 2 a.m. GABA is something you can use for sleep to keep you asleep. Now, melatonin helps you go to sleep. It doesn't help you keep you asleep as much. And some of our clients have used 4 capsules of GABA, subtablets of GABA at night. And then, of course, maybe propolis would be a very option to help her shoulder pain that she was having, which I thought was kind of a shingles related thing. Okay.
That's really cool that, changing the medication actually helped improve some of her results while she was following MM
Yeah.
protocols. Do you think the medication alone, did that, or did she make some other changes as well?
Because we went from a lower dose of total thyroid medication, right? It was Synthroid 88, and I went to 75 of Tirosint, right? I actually lowered that dose, and yet the T4 went higher. If you had told me, Dr. Phan, you increased the medication, that's why the T4 went higher, that would make sense, right? Or if you told me that,
Okay.
she had a big flare, her thyroiditis, Hashimoto's went nuts, and she was just breaking apart her thyroid cells and just releasing thyroid hormone into the cell. And you would say, well, I'm feeling worse. I'm feeling palpitations. I'm feeling like some days I'm really energetic. Some days I'm just crashing. Then I would say maybe you're having
Yeah.
a Hashimoto's flare, a viral flare that's creating more breakdown of your thyroid cells. But she's actually improving symptomatically. This is why it's important to pay attention to symptoms as well as
Yeah.
labs, because labs can throw you off. Let's just play this game. Let's say she came in and her cholesterol went higher, right? Or her numbers were the same. What do I use to gauge that? If the numbers were the exact same thyroid wise, I'd say, look, I reduced the thyroid medicine, yet you're still maintaining the same. It means that she doesn't need as much, or the medicine is so clean that it's not triggering viruses. Is that the titanium dioxide or the corn, and is not feeding viruses? So either way,
Right.
I think we're going along the right path if her symptoms are better. And so, does that answer your question?
Yeah. Yeah, it does. I think that that's giving people a little more insight into how changes in medication can work and what they can advocate for themselves in their
Yeah.
doctor's
Yeah.
offices.
So
Right.
we just kind
That's
of,
pretty cool.
I mean, when I see patients, I could talk for an hour or two, and it's just really bad because I have other patients waiting, so they're like trying to tell me everything, and so I'm trying to fit this in within. So basically, there's some simple stuff, a few changes, just to kind of see, because if I do 10 at once, I can do 10 at once, but you won't know. You'll be like, I don't know,
Right.
it's just too much for me to, to take an assessment of. So I recommended propolis for the shoulder pain, increasing that or bringing it in. Go slow. If she's, when you tell patients, if they're a very sensitive person, you have to kind of go slow and just see how you do. If a person who is pretty like built like an
Yeah.
ox, they can take anything. Yeah, you can go at the recommended dosage, right? Long-term strategies. We're going to continue to watch that cholesterol. She was worried about cancer, and I talked about melatonin's benefits. She's already using, I think, she could use some more, and you have to build up to melatonin. And then her teeth, about her teeth, and as we know, teeth, sometimes you'll notice it when you get in medical protocols, and it's like, what's going on here? Is it medical medium, or is it just what the inertia of past stuff going on? In that case, it's, are you
Yeah.
releasing more ammonia into your, from the liver, and it's basically, eroding some of the gums back. You want to bring silica, nettle,
Yeah.
and MSM. You really want to make your body more alkaline, but not
Right.
by adding alkaline water per se, but bringing in things that help with the alkalinity of the body, like the fruits and vegetables and the smoothies and all the protocol stuff. Okay, and that's it basically. Let me close this off real quick and go from there.
Thank you for that presentation. That was actually really cool to see. Somebody asked, could you touch upon blood work recommendations and how to do it safely? Do you mean come off medication videos in my playlist, which is a really
Say that
cute
again.
handle?
Videos my famous. Okay, yes.
I,
Okay. Um,
the handle is
well,
kind
in
of
the books,
funny.
Anthony talks about uh, free T3, free T4, and TSH, and thyroid antibodies. Currently, I know of two of that we can use on a routine basis: thyroid peroxidase antibodies and thyroglobulin antibodies. Um, Not all doctors will run them. Most doctors will run TSH, maybe T4. If you're lucky, they'll get a TPO or thyroid peroxidase antibody. But the other one is usually not looked at, and thyroglobulin antibody. That one will tell you, because a lot of patients who don't realize they're Hashimoto's, because that marker is positive, but doctors don't check it. So those are the ones I recommend checking. Do you have to do it? You don't. And also, you have to know, like, how often should I check it, or what will I do if this is off? I have patients who fit in the TSH range that are high and will be classified as hypothyroid, but they don't want to be on medication, and they feel worse on the medication, right? One of those components for feeling worse is that, are you on the wrong medication? Is this medication does that corn, is it gluten in it? Because you're getting a cheap generic one and you think it's the main ingredients the same. But again, using the higher end ones, which
Right.
cost more, I'll give you that. It might be better for your system if you're trying to avoid, you're avoiding gluten, eggs, and dairy, corn, canola, soy, and colorings and stuff, but your medication has it, so you're not getting away from it. So these are some of the subtleties that you deal with when you have the mental energy to do so. Some people just can't handle this. Like, this is too much for me to do. I can't. So you work on the medical meeting protocols, and you can still see a lot of healing with that.
So our next
Yeah.
question, thank you. That was really helpful. Our next question is, how will the TSH look in a similar case but without the thyroid? Should it still go down considering the hormones may be produced by the
It's different for each
adrenals?
person. I mean, that's why you should work with your doctor, as we say. Always work with your doctor to do this. Otherwise, we get in trouble. But yeah, it could. Like I said, people. I've had cases where people say, "I don't even have a thyroid." They cut it out when I was 3 years old, and this lady came to see me, and she's like, "I got an MRI done, Dr. Phan. I need a refill on my thyroid medicine, but the MRI here's the MRI results." And lo and behold, the MRI of the neck, she was having neck pain, showed that there was a big old thyroid pushing on the left side, pushing into the chest cavity on the left side. She's like, "Oh, that's interesting. I didn't know that. They told me they cut all my thyroid out when I was a baby, but they left a little pencil lead amount in there. It can regenerate."
Right. Wow, this is excellent information on using info and medical info together to work with your doctor. This is what it looks like to work with a doctor who respects you, who has compassion for you, who listens to you, and you can achieve some great results. I always say, like, the bridge between the natural world and the medical world, like, we need to come together more so that we can actually create massive amounts of healing for people, because I think that bridging these two sides would just be amazing. Look at what Dr. Phan is able to do with one person. If we had more doctors open to this information, or you want to share this little case study with a doctor and show them what's going on, what is possible. There's so much healing that can happen for people. So our next question that I want to come to, Renata asked a question. She is dealing with some heavy symptoms. So let me just pull up her question. And she said, can shingles or EBV create sudden leg numbness and weakness, loss of strength, and create incontinence? Maybe if the back is already weakened from chronic back issues. And her next question was, what can I do?
Okay, so in those cases, you really need to be seen by somebody to make sure that there's not a nerve impingement or a herniated disc that's pushing down. If it's one-sided, I'm not sure if it's both sides. You really got to be seen quickly because you're worried about, uh, you know, the spinal cord being compressed somehow. There's a caudate equine syndrome, all these different things, and already if it's affecting the bladder, you really need to be seen by somebody. Okay, the back is already weakened, yeah, but is there something pushing down on that? And that's where you get you got to have more information, right? Yeah, but
Yeah.
the true cause of it,
So
yeah, it can cause it, because Epstein Barr can cause inflammation in the root, but it also can cause masses and tumors and pushing down on stuff.
so I think that, just want to plug in a little bit here for Renata. Um, Shingles can create weakness on the pudendal nerve, and the pudendal is responsible for maintaining weaker, and you have a back issue also, chronic back issues, chronic weakness in the back also comes from shingles. So it is possible that you're down along those same nerves and that the swelling has gone further along the nerve, creating incontinence. It's very possible to do. But of course, we know that the more common reason for incontinence can be from the bladder, having strep and EBV in the bladder, which can also lead to incontinence. So, actually, if you have both going on, or low levels of both, or you're having a flare in both, then it will exacerbate the problem. So, I just wanted to explain that. And then also, you're saying that you're feeling heavy, and what can you do? Shock therapies definitely come to mind, because for shingles, you really want higher levels of golden seal, propolis, and mullein. Those are three of the most powerful herbs against shingles. And lysine, ALA, magglycinate, California poppy, um, a little neuromag is helpful. Of course, the basics, zinc, B12, vitamin C, those are all very important. But those three antivirals that you could, even lemon balm, could do shock therapies for. So, lemon balm, cal poppy, golden seal, propolis, zinc, and vitamin C. If this was me and I was having a flare of neurological fatigue where my body was starting to feel heavy, and what neurological fatigue basically means is that your nerves are swelling up, and that's what it sounds like is happening. I would hit up all those shock therapies and I would do them all in the same day and do them for about a week and see what happens, because they can really make a difference. I hope that that helps, Renata. And of course, turmeric, ginger, garlic shots are helpful. So curcumin can be very helpful too. Um, and nerve shifter shots also very helpful. Dr. Van, do you have anything else to add to that?
I don't know if it's causing pain. Ice might be a thing that brings
Yeah.
down inflammation quickly.
Yeah. I mean, even if there's no pain, ice can be helpful to bring down swelling. All right, cool. I hope that helps. All right, our next question is, can you talk about reactive hypoglycemia?
So I bet you've had more patients than me about those issues, because most people are not, my clients are not following all medical medium. But your adrenals really need a lot of help, and you need to be, if you can, add more greens, basically. The minerals need a lot more help in that regard, so that, when you're having some fruit or whatever, it's not just going straight to the system. I don't know how backed up your insulin receptors are with fats in the past, or adrenaline, cortisol. Those are some things that can really affect the ability for you to tolerate a lot of the glucose that you're getting.
Could you talk about the difference between reactive hypoglycemia and other hypoglycemia?
Well, the reactive is more like, as I understand, okay, is that is you eat something, and then glucose, something, and it drops.
Mm,
Whereas the other hypoglycemia is that you haven't eaten anything, and you drop because you don't put anything in the system.
right.
Well, this is a challenge. People, I'm trying to incorporate more fruits and vegetables, but when I do, it seems like my sugars actually drop rather than increase like it's supposed to. And I think a lot of those times people are highly stressed, and their cortisol levels, because I mean the ways that you can block insulin from getting in there and allowing glucose to go into your cells is by having a high fat, high protein, or the cortisol or adrenaline is complexing with insulin and making a big kind of molecule that doesn't allow the insulin to get into the insulin receptor. So when it's big a fat molecule, it can't get in there, and so the glucose can't go in, and you can't get replenished. So
Right.
a lot of times these patients are really stressed out. I mean, again, incorporating a pound of greens, something like that a day, would be really good. Um,
The greens are really important.
yeah.
Also, if you're taking chromium or something like that, which also brings glucose down a little, you might want to lay off that. I don't know if you are. But reactive hypoglycemia is really about the liver and about finding, how much fat is in your system, because clearly hypoglycemia, Anthony says, is the precursor to diabetes. So while you might have hypo, meaning low blood sugar, and you consistently drop sugar when you eat, overall it's leading to a problem that's going to result in high blood sugar. So that's related to the liver, and you really want to look at your overall fat intake and reduce that. I find that I've helped many people let go of diabetes, pre-diabetes, even glycemia, hypoglycemia, hyperglycemia by removing fat from their diets, like overt fats, high fats, saturated fats, and really lowering the amount of fat in the diet. And then you can actually um, find a lot more healing because the carbohydrates are absorbed better, you have less insulin resistance, and all of that works better. So I hope that helps. So our next question is from Iona, and Iona says, I have chronic recurring mono throat combined with strep throat. I've had it like 40% of the time for a year. I'm fat free. I'm fully on Is it a tricky thing to heal? And is it common to have it long term? Dr. Phan, what are your thoughts on that?
Yes, it's very common to have it long term. In fact, I just saw this person today with one of the markers, the Epstein-Barr marker, the IgM, immunoglobulin. IgM. That was positive, and that's usually a marker of reactivation. She had two markers that showed that she's had it in the past, but the one that's kind of a more recent or chronic shows that she's had that there. And it's hard because it means you've had it for probably a while and your immune system is weakened from stress or whatever it is, and so you have to keep on working on the protocols. Remember that strep and Epstein-Barr, they're partners, and they both work at suppressing your weakening your immune system so the other can move ahead basically. And so if you're having those issues, are you on the protocols? Do you need to up the protocols? Maybe you have to go a lot higher. But it is difficult because it's probably been there for a bit, and I'm assuming you feel it. No amount of antibiotics are going to fix this. It's going to be using the herbal antibiotic regimen. And remember, herbs are like you're a boxer. Remember, you're a boxer in the ring, and if all you have is this, you're not getting very far. You need the hook and the uppercut and the jab and the stick and move and stuff like this to get them all together.
Yeah,
right.
It's true. That's a really good point. So this is a thyroid question. I was diagnosed with thyroid cancer and had half of my thyroid removed. What can I do to prevent cancer in the future and also keep my thyroid working?
A lot of patients have a thyroid, a portion of their thyroid. I think in the book was like 16%. It was like 16th they have left, and they're still working fine. So you got to also help your adrenals. If you're doing the protocols, great. There's a whole section of protocol in the Cleanse to Heal book on cancer. So bringing those one of the major ones being melatonin, you got to work up to it. You knock yourself up 20 milligrams at once, you're not going to feel good for some people. So go slowly up, or if you're having issues with melatonin, as you increase it, because you're really groggy the next day, as Muneeza told me, is that you're not getting enough sleep. So you need more sleep. Working on those protocols is important, and you can keep your thyroid working even with half a thyroid, even with a quarter of a thyroid, even a 16th of a thyroid. So cleanses. How many of you guys have done cleanses? If you need a little bit extra, if you can do it, even if it's simplified, it's helpful.
Yeah, so I just want to caveat this by saying that we're not allowed to tell you that anything can prevent it, right? All we can do, or even cure it, or whatever. We're not allowed
Yeah.
to say that, and we're not saying that because we're not allowed to say that.
Mm-hmm.
So you can do these things to support yourself, right? Whatever support your body needs, you can get from some of the tools that Dr. Phan recommended. Okay, so our next question is, I've been labeled with a subclinical hypothyroid as of now, 6-year-old child. Okay, they are checking levels but pushing to take the meds. Would you suggest to try keep doing natural healing with support from supplement? Levels do fluctuate, and I want to avoid medication if it's not needed, as he has had as high as 15, but the last blood work, the TSP, is at 5, and they will check again in a week.
So probably TSH, right? So TSH,
TSH.
TSP. So yeah, I mean that's actually a good sign, right? If it were my child, I can't tell you what to do, but if it were my child, I would say, hey, what are his symptoms? Is he having symptoms? Is he having problems? If he's not, then I would like to continue to monitor and work on this stuff. How adherent is he to some of the protocols? I don't expect to be perfect with a 6-year-old, but implementing as much as you can and trying to get the thyroid healed as much as you can do it using the protocols. So yeah, I would say I'm all for it, but again, consult with your doctor and make a choice based on his individual symptoms and signs.
Yeah. Yeah. So you do want to check with your doctor. Always, always, always do that. And I know you're doing that. But the thing is, with medication, you can always wait and see, right? Unless it's life or death, like, and you don't have time to wait, so you're in the hospital, and if you don't do something, it could, be a really serious situation. But you can always wait and see. You can always wait and eat. Um, Try the natural supplements and try the protocols. Talk to your doctor about it. Say, I want to try. And some people even arrange with their doctors to do a natural path and then agree to some testing so that the doctor feels comfortable as you're taking this path to heal. There can be many ways to talk with your doctor to come up with a plan that works for you. So I would encourage you, especially with a young kid,
Mhm.
to try to do that. Um, okay, so
The place where you want to be on medicine is when you're having heart failure and things where they go to the hospital. I have people who stop their thyroid medicine cold turkey because they get excited and they develop a lot of fluid buildup and they can't breathe very well and they have to go to the hospital to get treated. So that's one of the bigger major red flags you want to be careful about.
yeah, definitely. Candy says, if you're on a no-fat diet, is it okay to use coconut oil in your body? Yes, totally fine. Coconut oil does not absorb into the bloodstream because the fat cells are actually quite big and are not able to even go through the lower levels of the dermis. They just sort of go into the upper levels of your dermis and your epidermis. So um, topically, oil and the creams and things are all fine. Okay, so thank you, Dr. Phan, for all your time today and for putting together this incredible case. What I want to request all of you who are watching right now, before you go, please, please share this. Share the link to this video. Please subscribe if you're watching. We will be doing uh, more episodes like this where we dive into cases, numbers. Dr. Phan and I are very fortunate. I'm very fortunate. I get to work with him on several of my cases and get his input, which I'm very grateful for. And I'm sure the people who receive that help are also very grateful for. So please share it because we want more people to be aware of how we can work together with medical medium protocols, taking a natural approach, and working with a medical doctor. This is so needed right now in our time. And it would be amazing if you can spread the word about this because really you guys are amazing at doing that. So please, 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 one thing you can do us to thank us if you love this video is to share it.
And subscribe to our channels.
And subscribe to our channels, both Dr. Phan, MD, with Spirit, and my channel if you're watching on it right now. Thank you, everybody, and we'll see you soon. Bye now.